Hi, this is Dr. Christy DeSaffrey, founding physician of Bone and Body Women's Health. Today I wanted to talk about vaginal estrogen and how we treat genitourinary syndrome of menopause. I know that's a mouthful, but what it really means is the changes in the bladder, the urethra, the vulva, and the vagina at the time of menopause. So it's a really comprehensive term. Many women come to see me and they have some incontinence, like urge incontinence, where they are frequently urinating or they're having chronic urinary tract infections. These are also all signs of genitourinary syndrome of menopause or loss of sex hormones, particularly estrogen, at the time of menopause. We like to say in the medical community that genitourinary syndrome of menopause is chronic and progressive. That sounds very scary, but what it really means is that these changes do not get better with time, and as time marches along, and we know women are living on average until their mid-80s, these symptoms will continue. So oftentimes we see the sequelae of these symptoms of women having recurrent bladder infections, urge incontinence, heading to the incontinence aisle and buying pads and all the other things that are on the market now that really don't fix the problem and are just a Band-Aid. So when we think about addressing this genitourinary syndrome of menopause specifically, we want to think about giving back things like vaginal hormones, like vaginal estrogen, vaginal DHEA, other moisturizers and lubricants can help. This is a very exciting area. We have actually a lot of options in women's health. So I do not think the first line of treatment should be wearing diapers or, just sort of living with this and not exercising, not jumping, knowing where every bathroom is from here to your office. It's really important to talk to someone who can give you options. Vaginal estrogen specifically, when we speak about that one, is very safe and very effective. We know we even had a recent study of 50,000 women with breast cancer who were age 40 to 79 who were studied for many years, and we looked at cohorts of these women, and women who used vaginal estrogen who had breast cancer, there was no increased risk of their breast cancer mortality. So even in populations where we know that there are hormonally sensitive cancers, we use vaginal estrogen when we can, and when we discuss that with the patient, obviously, and their healthcare team like oncologists. So it's very important. We have lots of options for vaginal estrogen, vaginal hormones to treat genitourinary syndrome of menopause. And I would also argue prevent genitourinary syndrome of menopause, prevent vaginal dryness, painful intercourse, recurrent urinary tract infections. This is very common, but not normal. So we can treat that, and I hope to see you soon.